Hello, good morning, everyone. Thank you for joining us today. We will get started here now that my clock has turned 11:30. My name is Amanda Davis. I'm a research coordinator with the Knowledge Institute on Child and Youth Mental Health and Addictions, and I will be your facilitator for today's session. Today, we bring you Putting Evidence into Practice, Knowledge Mobilization Beyond COVID-19. This session is the last of our Spotlight on COVID-19 Recovery series that we launched in April 2022, where we've brought together many knowledge experts, leaders, young people, and families to share evolving evidence and their insights on topics related to a pandemic recovery state. So we'll just pull up our agenda for today. So we're going to start with opening remarks, and then we'll have quick housekeeping notes, panelist presentations, and we will follow those by a facilitated discussion, including an audience Q&A before we part. So to provide our opening remarks, we are fortunate to have Amy Porath-Eves, who is the Director of Research and Knowledge Mobilization at the Knowledge Institute. Amy has over 22 years of experience facilitating substance use research and knowledge mobilization activities. Amy is a leading expert in this field, and her knowledge has been sought out by the Government of Canada, parliamentary committees, and the World Health Organization. At the Knowledge Institute, Amy directs our efforts to identify and respond to the knowledge needs of the child and youth mental health and addiction sector and others who shape policy in this area. Amy, I will hand it over to you.
Great. Thanks so much, Amanda, and welcome everybody. We're so thrilled that you could join us today in this webinar focused on knowledge mobilization. We have a really exciting lineup of panelists today, and we're going to introduce each of them in turn shortly. But I'd like to start by recognizing that today we're gathering virtually, and this means that we're joining from many different places. And I'd like to invite everyone to consider your individual and collective relationships with and responsibilities to the Indigenous nations whose territories you're on, and the land and waters on those territories. The Knowledge Institute is located in Ottawa on the traditional and unceded territory of the Algonquin Anishinaabe people. And the peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and their culture and presence have nurtured and continue to nurture this land. We at the Knowledge Institute recognize the history, strengths, and diversity of First Nations, Inuit, and Métis communities, and are committed to engaging respectfully with Indigenous children, young people, and families within and across nations in what is known as Ontario. We can go to the next slide. So as a bit of an introduction and stage setting for today's webinar, I thought I would briefly introduce our work at the Knowledge Institute for those who may not be familiar with us and our work. So we're a provincial program based at the Children's Hospital of Eastern Ontario. And for the past 19 years, we've been focused on mobilizing knowledge and improving quality across Ontario's child and youth mental health and addiction system to support positive outcomes for children, young people, and families. And we do this by sharing evidence, building capacity, and creating connections to close the knowledge to practice gap. Our work at the Knowledge Institute spans the early years right up through to the transition years, and we target our efforts in 6 strategic areas of focus, including complex needs and intensive services, integrated care pathways, equity, diversity, and inclusion, youth and family engagement, virtual care, and more recently, substance use and addictions. We can go to the next slide. So knowledge mobilization is really one of our main focuses of work. And during the past 3 years, we've had many unique opportunities to grow and challenges to face while putting knowledge into action to help shape service provision for children, young people, and families in a time of unprecedented social change. We've developed a number of COVID-specific knowledge products and resources, including the webinar series that you're taking part in today, as well as a number of fact sheets, infographics, and reports on themes such as child and youth mental health during the pandemic, child and family bereavement, impacts of screen use on young people's mental health, just to name a few of the topics. We've also developed several resources to support people working in the sector to increase the impact of their research and engagement efforts, including our toolkit on knowledge mobilization, which Sarah is going to be speaking more about in the webinar today. We're just so excited to showcase 3 organizations who are working in the sector and hear about their approaches and successes to knowledge mobilization, as well as some of the lessons that they've learned along the way. So I hope that today's webinar gives you all some fresh perspectives and insights on knowledge mobilization, and that you go home taking some resources that you can use to support your own efforts. So I'm going to now turn it back to Amanda, who's going to review some housekeeping items and introduce our first speaker. And I hope that everyone enjoys the webinar today. Thank you so much.
Thank you so much, Amy. A few housekeeping notes before we move on. We do encourage you to submit and upvote your questions for our panelists in the Q&A tool that you can find at the bottom of the webinar screen. As well, please feel free to use the chat to share your thoughts and engage with other attendees as we move through the session. We also do have the option for closed captioning available if you need it. If you run into any tech issues, we have mine and Nikki Summers' emails on the screen, which we can also put in the chat should you run into any concerns. So to start our presentations, I will introduce Sarah Pinder, who will be highlighting the Knowledge Institute's newly reformed Knowledge Mobilization Toolkit. Sarah is a knowledge broker at the Knowledge Institute. Sarah is also an esteemed writer and arts-based educator with a background in community mental health research. Sarah, over to you.
Thanks so much for that introduction, Amanda. And thanks to all of you for joining us today for this webinar. In my presentation today, we're going to be exploring the Knowledge Institute's refreshed knowledge mobilization toolkit called Doing More with What You Know. We've developed this toolkit for anyone working on knowledge mobilization projects, especially those who are in the initial planning stages of the work and those working in the child and youth mental health and addiction sector. Next slide. So on our agenda today, I'm going to be taking some time to talk about what's included in our updated toolkit, why we mobilize knowledge, what we include under the umbrella of the term knowledge, how to plan, conduct, and evaluate a knowledge mobilization project, and where to access the Knowledge Institute's resource hub and download the free toolkit on our website in English and French, as well as other resources. The toolkit will be launched on April 4th. Next slide. So our updated toolkit includes a step-by-step guide to knowledge mobilization practices, tips and tricks you can use in your knowledge mobilization work, links to additional resources to further build your knowledge, and examples of knowledge mobilization work happening in the child and youth mental health sector. The COVID-19 pandemic has been a time of rapid-fire knowledge mobilization efforts. We've updated our KMB toolkit to give those doing knowledge mobilization work current and comprehensive information to support you in developing and sharing high-quality, impactful resources today and into the future. Next slide. So when we say knowledge mobilization, what do we really mean? Activities that make evidence accessible, clear, and useful for knowledge users who need it, including things like knowledge synthesis, dissemination, transfer, and exchange. Knowledge mobilization, which is sometimes referred to as KMB, and knowledge translation, sometimes called KT, are frequently used interchangeably. Knowledge mobilization is generally used when referring to social sciences and humanities research, and knowledge translation is used in medicine and the sciences. In the child and youth mental health and addiction sector, knowledge mobilization speaks to the use of evidence and expertise to align research, policy, and practice to improve outcomes for children, young people, and families. For example, let's say an agency that provides services for children has program evaluation data and wants to share the findings in an interesting, useful, and accessible way with staff and clients who've been involved in the evaluation process. Knowledge mobilization can help to do this. Next slide. And what do we mean, or why mobilize knowledge? Sorry. Okay. Why mobilize knowledge? Why do we prioritize mobilizing knowledge? Knowledge mobilization draws attention to issues that matter and enables people to strategically use information to create change and make improvements in the world around us. The practice of knowledge mobilization is not simply about publishing the latest evidence for end users. It uses meaningful engagement to make sure information has impact. KMB is not just about disseminating, sharing, or publishing information in one direction. It's about meaningful engagement, end user participation, and working towards using evidence to have an impact. Increasing the accessibility of knowledge increases the likelihood that it's going to be used. Knowledge that has been mobilized through things like knowledge products, events, and networks can help people to address problems in their lives and communities, mobilize for change, raise awareness, and provide meaningful evidence to collaborators that initiatives are impactful. Next slide. So at its core, knowledge mobilization is about people and relationships. It's about communicating valuable information with the right people at the right time to help ensure meaningful engagement and impact. Knowledge mobilization is not just about putting information out for consumption. It requires developing resources in partnership with the key audience for those resources, recognizing that audience as an equal stakeholder in project development. It's important to engage your audience during the planning stage to design and deliver information and tools in a way that makes most sense to them and ensures they're involved at the level that they want to be in all stages of the project's development. So planning a successful knowledge mobilization project requires you to consider a number of factors before you start. Like, who will be involved in sharing the knowledge? Are there credible partners or community champions that can join you in the work? And who do you want to use the knowledge? What knowledge do you want to mobilize? And what are the key messages that you want to uplift? Why do you want to mobilize this? Why are these messages important to your audience? When do you want to mobilize your knowledge? And are there other things happening at this time that might affect uptake? How are you delivering your message to your audience? How are you going to engage with them when developing these KMB materials? And measurement. How will you know when you've achieved your goals? What indicators will you use to measure your efforts? Next slide. So now that you've considered the details required to make a solid plan, how will you put that KMB plan into action? There are three main types of resources commonly produced in knowledge mobilization work. Engage with your partners and key audiences to decide which type of resource is going to work best for your project. You could develop knowledge products, which includes things like reports, fact sheets, infographics, and toolkits. Events, so that's things like conferences, webinars, forums, debates, and workshops, but it also includes things like TV and radio interviews. And networks, which refers to frameworks that connect people together, often virtually, like communities of practice, online forums, social media listservs, and message boards. No individual strategy is going to work in every situation, and you might need to choose several different strategies to target different audiences. Next slide. So taking the time to focus on making your story accessible to a wide audience and sharing information in a compelling way can mean that knowledge you're sharing has greater uptake. You can use clear language to convey your message by writing in the active voice, using a familiar and welcoming tone, avoiding jargon and defining technical terms in easy to understand ways, and using lists to make information quick to access. Using clear language removes barriers between you and your readers, making it easier for everyone to understand and use the information. Beginning with a solid understanding of who you're wanting to speak to, what your communication goals are, and the main messages you're trying to get across can help your projects to stay focused and make it clear what the essential components of your story are. You can also use storytelling. Most media we consume today, from news to entertainment, relies on narrative storytelling to get and keep our attention. Stories are so good at sharing our attention because humans are social beings. We want to relate to others. Showing your voice and personality and how you convey your message and speaking from the heart can help you to connect with your audience. McCall and colleagues note in their 2021 paper on storytelling and public health that storytelling has a unique ability to change behavior because it allows for more nuanced, contextualized, and culturally reflective information to be shared. Change can happen when members of the public can clearly see how knowledge is directly relevant to them in their cultural context. Next slide. So you've now made your knowledge product, event, or network. How do you know if the information you've shared is getting into the hands of the right people and if that information is being used? Using evaluation to explore the process, outcome, and impact of your project can help you answer these questions. We know that evaluating outcomes and impact are important, but don't forget thinking about your process as well. Evaluating how you did the work will help give you crucial information about the success of your project and can also help you improve your methods for future projects and partnerships. What can be carried forward and what might need to be refined or set aside next time? Consider using mixed methods in your evaluation. Drawing on both qualitative and quantitative data can give you a more holistic picture of your project. You might also run into challenges in your knowledge mobilization work related to things like lack of measurable targets and outcomes, lack of adequate high-quality evidence, and challenges measuring impact. Evaluating your work at every stage can help you identify these difficulties and work to address them. Our toolkit includes discussion of these challenges and ways to overcome them. Next slide. A well-designed knowledge mobilization project can effectively raise awareness and prompt change, connect people together, and put knowledge into action in our communities. We hope our free knowledge mobilization toolkit, Doing More with What You Know, will be a helpful resource in your KMB projects to come. You can download it in English and French from the resource hub of our website on April 4th using the link here. The resource hub is also where you can find the Knowledge Institute's other knowledge products in English and French, like fact sheets, reports, toolkits, infographics, and webinar recordings on a wide range of child and youth mental health and addictions related topics. Thanks so much.
Thank you so much for that overview of our new toolkit, Sarah. I know I'm really excited to use it more in depth, and I'm sure it's going to be such a great and a valuable resource for others as well. So next up, we are going to hear from Travis Stainert. Travis is the knowledge mobilization specialist at Frame. In his work, Travis regularly consults with sector partners to foster collaboration and share evidence to inform their work, and develops a variety of knowledge products from data briefs and summaries to large-scale evidence reviews. Outside of Frame, Travis shares his passion through working with mental health and addictions-based organizations as a research consultant and instructing the certificate in knowledge mobilization with the University of Guelph. Travis, I will pass it over to you.
Great, thank you so much. Hi, everyone. So thank you for having me on this panel today. I'm excited to talk with you about all things knowledge mobilization. So my name is Travis Steiner. I'm the knowledge mobilization specialist at Frame, which I'll talk about in a little bit if you're not familiar about what Frame is. But my job is really about asking the so what and now what questions, right? A report gets done or a project gets done. So what? And now what? How can we put it in the hands of the people that can use that knowledge and connect a network with relevant stakeholders and end users that can put that knowledge or help raise awareness of that knowledge or put it into use? So just a little bit about Frame for those that aren't familiar. Frame is a national knowledge mobilization organization advancing integrated youth mental health and substance use practices in Canada. So we're what you would call a system intermediary or a knowledge mobilization intermediary organization, which really has the goal of supporting the provision of services rather than providing direct services itself. So we don't actually provide the services, but we do help those working to provide the services to spread, scale best practices, and capture lessons learned. So we host a network of over 400 partner organizations, including clinicians, researchers, policymakers, and service providers, with the goal of facilitating collaboration and knowledge sharing among organizations, all working towards sort of system transformation for youth, caregivers, and their families. So it's our mission to bring folks together into our network and connect them and engage across the sector. So with that being said, we would love for you and your organization, if you're not part of the Frame network, to become part of it. There's a QR code there that you can scan. And so we're hopeful that you'll like what we're saying today, and you'll resonate with our work, and you'll join our network to get access and be the first to know basically about all the knowledge sharing opportunities and activities that we do. So how do we work? How do we actually help with knowledge sharing? We do a lot of what the Knowledge Institute also does, right? We facilitate knowledge mobilization activities in a variety of ways, including our annual Learning Institute, which is like our annual conference. Our last one was in Vancouver. It was really great. We run grant programs. We collaborate on projects with network partners. We offer a knowledge exchange service. We support youth, caregivers, and mental health advocates through our Groundbreakers network, which I might talk a little bit more about today. It's basically a network of lived experts to help inform the sector. And we also help host webinars, We amplify lived experience and expertise through our blog and our podcast, and many, many more other things. But importantly, what you see on the right is our triangle. So no matter what we do, we always try to triangulate the evidence and the knowledge that we're supporting. And we do that by keeping a pulse on sort of the research evidence. What does the research say? But also, what do practitioners say, right? About those people that are actually working in the system? What knowledge do they have in terms of, promising practices, in terms of lessons learned, key findings that we can share and bring to the knowledge? And then importantly, what do youth and caregivers themselves with lived and living expertise say? And we really try to amplify that in everything that we do. Obviously, a big part of what we do, just like the Knowledge Institute, is engagement, right? And meaningful engagement of youth and people with lived and living expertise. And so we did come up with this, this little diagram based on a literature review that we did, looking at what are the key components, what are the core components of engagement, and more importantly, meaningful engagement. And so this is our little way of helping you frame up engagement, as it were. Sorry for the pun, but really at the foundation, you have the core values. Once you have strong core values about meaningful engagement, you can work on your structure and approach, which is around communication, decision-making, and governance. And of course, that's all buttressed through engagement practices that are informed by equity, diversity, and inclusivity. Once you have that structure and approach down, then we really work around supporting policies and practices such as recruitment and recognition that underlie those sort of core values in that structure and approach. And if anybody's interested in finding out more about this, please feel free to reach out to Frame, and we're happy to talk more about this, this engagement framework that we've built. And so onto the big question, how did we work during the pandemic? Well, we kind of worked how everybody worked, right? We pivoted, we were agile. It was a challenging situation. So we worked for transformation, for system transformation. We ramped up new ways of working. We were looking at what's going to be the new normal, because traditional ways of working were sort of upset and so it was really unprecedented what we were working through. And so all the things that every organization working in youth mental health was going through, we were also going through with you, and we were really working during the pandemic to listen, right, with open ears and open hearts to what people were saying, what the needs were of the sector, and respond to those in a timely and informed way. And hopefully we'll get the chance to talk a little bit about that during the panel discussions. So thank you for listening.
That was great, Travis. Thank you so much. I love those puns about frames. I'm a fan of puns. So now we have Abby Walker. Abby is the outreach lead at Kids Help Phone. Specifically, Abby works with the Good to Talk program with the goal of increased awareness of this service among post-secondary students in Ontario. First starting her education and work in business, Abby realized her passion for mental health, moving into the nonprofit sector, also volunteering her time with jack.org to increase mental health education among young people. So Abby, I will pass it over to you.
Thank you so much, Amanda. And thank you, Travis and Sarah, for those amazing and informative presentations. So yes, hello, everybody. Thank you so much for having me today. As mentioned, my name is Abby, and I'm the outreach lead for Kids Help Phone in the post-secondary space. So today I'm going to chat with you a little bit about Good to Talk and a little bit about Kids Help Phone as well. So Good to Talk, a brief overview is that Good to Talk is a support service for post-secondary students in Ontario and Nova Scotia. Just for the relevance of today, we'll just kind of focus on the Ontario aspect of the service. But some important kind of key notes of the service is that, one, it's 24/7. So we are available to support students anytime, anywhere, and it's also completely confidential. So students don't need to provide their name, their phone number, or any type of identifying information to be able to access the service, which we find is really important for students. And lastly, it's completely free. So we want to ensure that the service is accessible to all from different backgrounds and different kind of situations. And so those are three kind of key points that is really important to Good to Talk as a whole. So students can access Good to Talk by our 2 access points. They can call Good to Talk and they can text Good to Talk. And within that, there are different services that students can access. So the first service that we have is counseling. So students can reach out via calling and ask to speak with a professional counselor about anything that's on their mind, and have that professional to really chat through their issues with, whether it's about school, whether it's not about school. Somebody is always there on the other end to listen, which is really important. We also have crisis support, which is accessible by texting Good to Talk, in which a student will chat with one of our volunteer crisis responders. And this crisis responder will really engage in active listening and collaboration planning to take a student from a hot moment to a cool calm, is kind of how we describe it. And then the last service that we offer is information and referrals on local resources. So what we see a lot happening is that students are going to a new area, a new city when they're going to post-secondary, and so they aren't aware of the local resources that they're able to access. So students can call or text us and ask about the resources in their area, and we can provide that information. So we can go on to the next slide, and I'll kind of take us a little bit through the past. So Good to Talk was launched in 2013 as a partnership between these 4 organizations. So we have Ontario 211, who conducts the initial assessment of Good to Talk callers by gathering a little bit of information about what service they're looking for, what school they attend, and any kind of demographic information that our Ontario 211 partners ask is completely voluntary. Students are never denied service by not answering these questions. And our partners at Ontario 211 can also provide information and referrals if that is what the student is looking for. We then have our partners at Kids Help Phone, which is the organization that I am from. The Kids Help Phone team provides our professional counselors and volunteer crisis responders. So this is really when students are engaged by calling or texting Good to Talk. That's where Kids Help Phone really comes into play. And within Ontario, we also conduct all of the outreach efforts. So that's kind of what my team does, is working to increase awareness of Good to Talk among post-secondary students in Ontario. The third organization here is Connex Ontario. So they're able to provide information referrals to callers of Good to Talk, but these referrals are a bit more specific to mental health, addiction, and gambling. And then last, but certainly not least, especially today, we have our 4th partner, the Knowledge Institute on Child and Youth Mental Health and Addictions. The Knowledge Institute evaluates services and develops knowledge mobilization and training resources for staff. So a very big key to our organization of Good to Talk is the Knowledge Institute, and so we're happy to be here today. And then we can move forward into a couple additional resources on this next slide. We have these 2 resources through the Good to Talk Ontario website. So we have the peer-to-peer community, which is a bit more recent. We launched this in January of this year. And this is an online space for young people, co-created by young people. So it's a variety of online forums on different topics that students can go read through different threads of what other students are saying. They can reply to different threads. They can start their own conversation about an issue that might be relevant to them in that particular moment. And it really provides a safe space for peers to interact with one another, to offer words of encouragement, to cheer each other on, but also to provide resources that have benefited them in the past, whether it's something that they had on hand or maybe external resources such as Good to Talk and such as Kids Help Phone. And so that's one that we've seen really great uptake on, this peer-to-peer community. And I think we're going to see it growing in popularity over kind of this space in general. And then lastly, we have our campus services directory, which is, it's essentially the information and referral aspect of Good to Talk on our webpage. So while students can always call or text us to access information referrals on local resources, they can also go onto our website and access these resources. So they can type in their location and then select the resource that they're specifically looking for. And then a list will populate of resources on campus and off campus that can be kind of appropriate for the situation of the student. And kind of keeping in theme with that accessibility aspect of Good to Talk, all of these services that we will provide to students are either extremely low cost or completely free. So I think that that's a really kind of important note as well. So that's a little bit about Good to Talk. I'm always always happy to talk about Good to Talk, and I'm excited to share a little bit more through this discussion coming up. But yeah, thank you so much for having me. Really appreciate it.
Thanks so much, Abby, as well. There was a question in the audience that maybe you can respond to in the chat. Just one of the things you mentioned about moving from that hot moment to a cool moment via specific things. I think Steph asked in the chat, so I'll just point your attention to that as we move into the next presentation. Thank you so much, though. So last but definitely not least, we're going to hear from Erin Clayton. Erin is the manager of quality assurance at Pathstone Mental Health. Also a registered social worker and psychotherapist practicing in the mental health field for 28 years. Erin holds specialized training in multiple evidence-based treatment modalities and has worked with various child and family populations. Currently, Erin is focused on macro level change, leading the strategic planning for Pathstone and developing virtual service pathways to ensure timely, effective mental health services for all. Erin, welcome. I'll pass it over to you.
Thank you. Thank you for having me this morning. I'm very excited to be here, and Pathstone is very excited to be involved. So Pathstone Mental Health is the lead agency for children's mental health in the Niagara region, and we're an accredited children's mental health agency. We're a multi-site, multi-service, interdisciplinary agency. And what was strikingly relevant, I think, for our agency to be part of this webinar today is that we have really been working hard through our strategic planning process to be very intentional about who we're doing our work for and how we're maintaining the highest standards. And that's really helped us restructure our agency and our strategic direction about integrating data into our decision making and integrating knowledge mobilization, knowledge acquisition, participation, engagement, and transparency. So we recognize and are really striving to live those values in our efforts in knowledge mobilization. So specifically the transfer, exchange, and dissemination and co-creation. So as many of my other the other participants ahead of me have acknowledged, is really engaging our interested and effective parties and moving from involvement to meaningful engagement. And so we've tried to embed those partnerships in recent endeavors, and specifically around COVID, that was more challenging. How would we do that? How did we gain our participation, and how did we meaningfully engage, translate knowledge, be transparent, and how did we deliver it and collaborate? So we've had to, in children's mental health, for any participants, you'll know that our funding does not incorporate specific areas for this. So we've had to leverage many partnerships in our community and have been very fortunate to have memorandums of understanding with community partners spanning from our Indigenous partners, local colleges and universities, and other health entities, because we've agreed that we're all striving for the same goal, which is a healthy and well community and accessible and high quality service for our community. So some of our initiatives, to name a few, was our strategic plan. So in our digital service pathway, so speaking specifically about COVID, the world changed in March of 2020, and we had considered a virtual pathway, and then we had to do it. And for anyone who spent some time in nonprofit areas, we generally take things very slow, we marinate, and there wasn't really that opportunity. So here was an opportunity where we had to use some of the words, and I would use the same words that Travis has previously said, is practice and work from a nimble, flexible, pivoting place, which was a bit unusual. Further, we've worked with Brock University on several program evaluations. We have many research projects with Brock specifically. We've been working, and we were one of the first children's mental health agencies that made the move to measurement-based care. So a previous model was pre-post model. So we've been working with Green Space Health for many, many years. We also have been more recently using our social media, different platforms, virtual measures, and other mechanisms to both engage our community and translate knowledge. So we have initiatives in wellness walls and wellness stalls. We use EMHware as our clinical database, but have also worked with that company to build in greater usability, so telehealth and client portal, as well as staff training and user materials. And we have, as I said, really increased and developed comfort with our media use. So through the pandemic, we developed Pathstone TV. So looking at our clinical staff providing short series, videos, webinars, engagement on various topics. We created a mental health survey that we were quite proud of to take some good feedback about our community needs, successes, challenges, and we did quite a broad media exercise with that and developed subsequently some toolkits from the information that we gathered. And we've also tried to remain accessible. So learning lessons that specifically as an agency, we were using a lot of jargon, acronyms, and not always meeting the target that we were hoping. And specifically through COVID, it challenged us to think about how we might also be versatile with language. And so we've been working with Voice, which is an interpretation service and offers a broad range of languages through Doxy. So I am hopeful that we'll talk more in the discussion about the individual projects that we've had, but also lessons learned and challenges, because I think we continue and remain in a learning and flexible space as it goes with our quality assurance measures, quality improvement measures, and certainly the area of knowledge.
Thank you so much, Erin. So I just want to say thank you again to all of our panelists for highlighting the exceptional work that's happening across our sector to support children, young people, and families. So what I'll do now is I'll just ask everybody to come back on screen for our group discussion. We're starting to get a couple questions as well, but maybe we'll start the discussion off here as well. Just as a reminder, if you do have questions for our panelists, make sure to use the Q&A tool in the bottom of the screen, and we will pull those together. So I'll just wait for everyone. Perfect. So I think what I'll do is maybe we'll just kind of have this like open forum discussion, and I'll kind of facilitate these questions based on what we learned this morning, and then we can, once maybe one person answers, others can jump in, you know, depending if you had things you'd like to add to that. So to start us off, thinking about the, you know, all the accomplishments that you've all raised over the past year, what accomplishments are you and your team most proud of in the context of COVID-19? And maybe Travis, I'll start this question off with you.
Yeah, that's a great question. I mean, I think adjusting and adapting to contextual factors is a big part of what knowledge mobilization is all about. And so adaptability was key, especially during the pandemic. We really worked hard during the pandemic and beyond to make sure that we're really hitting on those so what and now what of the projects that we do and support. So specific projects that we're proud of during the pandemic, the first one comes to mind is the Virtual Innovations in Care grant. And so this was a grant really looking at the process and key learnings of service providers moving into virtual care, right? And how to do that and how to do that well, because there was a lot of questions around that. We also started our GBS grants, which is our Great Big Stories grant. And this is really to try to capture and highlight and share key learnings from pockets of excellence, right? Really good stories about care that's being done in the system. And we really worked here to ensure that our grant opportunities are as accessible as possible, you know, hopefully at zero barrier and relevant while working in systems and in organizations that really can be limiting. So we also did the engagement framework, which I talked about a little bit. We started our Groundbreakers network during the pandemic, which is a really great way to capture and leverage and amplify lived and living expertise. We also created and launched a matching support service to go along with the Groundbreakers network. where really every match there is knowledge mobilization, is matching sort of lived expertise to specific projects. We had to pivot, I hate to use the word of the pandemic, but we had to pivot to a virtual conference, our virtual LI. So that, how do you create meaningful connection and relationships virtually? It's not easy to do. We used a vFairs platform, which was actually really engaging. It's sort of a virtual space, conference space that you go into. We had swag bags sent to addresses. So instead of coming to us, we went to you. We had a little scavenger hunt in that vFairs platform with the frame pets that you had to find. And so we tried to really pivot and make it as engaging as possible. We started a knowledge series looking at integrated youth services, and another one looking at lived expertise and peer support. And those were really to bring experts together with people with lived and living expertise across different sectors to talk about big issues really that are sort of plaguing the system and come up with actionable solutions and policy recommendations. We also started a podcast, right? Again, sort of highlighting pockets of excellence, but really trying to dive into the learnings, what's working well, what's not working well, and how can others learn from what you've done and scale it up. And then we did some great work too with other partners. A great example is Homeward Research Institute. We work with them to help identify standards for apps for youth mental health. And so what are the standards that we should be capturing, and how do we do that? So those are just some of the projects that we did. I mean, being in a knowledge intermediary, basically everything that we do is knowledge mobilization. So I'm proud of the organization itself, but those are some specific projects that come to mind.
Yeah, that's great. I think something that stuck out to me was the way in which you really leverage social media platforms and really responding to the audiences that you're working with. And I think podcasts especially are such a great format right now. I think that's such a great way to get to people. So I love that you started that podcast. Abby, we know the last few years have impacted young people, but especially post-secondary students during a very transitory part of their life. So how did Good to Talk respond to these challenges through knowledge mobilization? And is that carrying forward with some of the work that you did?
Yeah, definitely. So yeah, we definitely did see an increase in students reaching out to Good to Talk throughout the COVID-19 pandemic, because especially, in those remote settings where students weren't able to go to campus to access traditional in-person counseling supports, it was extremely important to have an accessible service by calling and texting that students could access wherever they were within Ontario. So yes, in terms of kind of what we've really kind of tried to do throughout the pandemic, and in terms of knowledge sharing, is sharing more information with the post-secondary staff about what issues students are reaching out about, when students are reaching out about. And so we did this through launching what was called the Good to Talk data dashboard. And so through Microsoft Power BI, we're able to collect de-identified data on Good to Talk callers. So this could be like when the caller is reaching out, again, about what issue they're reaching out about, what service they're looking for, if it's for information or if it's for the counseling aspect of the service. And so my team really kind of went through this data to understand what could we share with post-secondary schools while still maintaining the confidentiality aspect of our service, because that was always going to be our number one priority. And so our team set an internal threshold of a certain amount of call reports for students reaching out per post-secondary school, to really ensure that when sharing information, there is no chance that we can see a student in a statistic. That's most important to our team. And so we identified 30 schools that met this internal threshold. And so we were able to share this information with them through the dashboard. So they're able to access live data as to starting from 2019 for the students that are reaching out to their specific post-secondary institution, but also viewing it as Ontario as a whole for the entire post-secondary space. So this is really valuable information for these schools in terms of having the ability to alter what supports they offer. For example, if they see a high number of students reaching out about depression, the ability to educate their students more on identifying symptoms of depression and the steps and resources that students can utilize and take to really take care of their own mental well-being, and potentially, support others in that situation as well. but it also gives the opportunities for schools to understand what peak times are students reaching out, and how can we ensure that they have the resources on hand for the situation when potential campus supports are overwhelmed, making sure that students are really armed with these resources, not just kind of, within those peak times, but kind of moving forward in general as well. So that's something that our team was really proud to be able to share. And we've seen kind of good feedback from schools in terms of the helpfulness, I guess, of the information.
Yeah, absolutely. And especially talking about that dashboard, right? Like, I think that kind of embodies what we're saying, like doing more with what you know, right? Unless we know, how do we move forward and make those changes to respond? Erin, I can imagine at an agency level, there's a lot of factors to consider when delivering information with families as well as providers. So you shared a list of initiatives that Pastone is leading. Do any stand out to you as key accomplishments specific to knowledge mobilization efforts?
It's a great question, Amanda. And I really think, and I don't know if it's because I have a COVID-centric thought, but we really, I think, did well to meet that mark through our digital initiative, like our digital service pathway. And why I'll say that is that in developing that, there was the natural barrier of now we were in a COVID-centric world. So how were we going to meaningfully engage our service users? And traditionally, we would have brought them in for focus groups, or we would have called, or we would have had people on site, and we didn't. And we were very thoughtful in planning and wanting to have the interested and affected parties on the planning committee, because we didn't want to take responsibility of developing a pathway that worked from our perspective and not from the user perspective. So it took a little bit of work to find youth families to build into and integrate into the planning committee. So we had to be creative about how we connected people, but we really took time in a high-paced time to have youth voice, family voice embedded in planning, in testing the pathways that we're using, in thinking about accessibility, and also working to translate that knowledge, not just as at the end point, but as we were planning. So at every interval when we were doing a SWOT analysis on the different virtual options, testing that out with a broader audience, which took creativity and time, but I feel really proud because we were thoughtful about accessibility, but training needs, user needs, and creating things throughout the process, which I think was a switch for us instead, where we had past thought this is a great idea, and I think more involved voice versus engaged, and then produced a product and said, hey, what do you think about this? We, through the whole trajectory, and we surveyed, and we continue to survey, is this working? Is it accessible? Do you find this helpful? So I think too, not ending that project at congratulations to us, we created a virtual care pathway. How do we keep monitoring and assessing and engaging in both the monitoring of it, the ongoing development, and the accessibility? So I feel very proud of that endeavor for those reasons, and also that it gave us this other opportunity to provide service.
Yeah, that's a great point, touching on that sustainability piece, right? Like, it's not just a one marker that you come to when you learn, and it's a constant learning process, and adapting and evolving as you learn more. So we're getting a ton of great audience questions. So I think I'm going to start rolling some of these into the discussion as we move forward. Travis, we have a question for you. Great overview of projects, which sound very interesting. Did you undertake any evaluations of these projects? And if so, can you share any lessons learned about the ways that you evaluated them, as well as the projects themselves?
Yeah, absolutely. We try to evaluate everything that we do at Frame. Sometimes it's easier than others, right? Like, how do you evaluate the impact of something like allyship to people with lived and living expertise throughout a project? I mean, you can ask them, but I still think you're missing a little bit. So sometimes it is hard to capture sort of the impacts that you can have in the system, but we do try wherever possible. And one of the things that we do when all the projects come in, like the Virtual Innovations and Care Grant, for example, since that was offered to different providers, different grantees across Canada, we tried to look and say, like, what are the key learnings here that are consistent across Canada, right? Despite context, despite being Northern Ontario versus, Manitoba or urban Toronto, right? Like, what are the key factors? And so we put those together and put those out. So I can definitely share the key learnings. In terms of the evaluation itself, is be flexible. Evaluation is one of those things that people sometimes don't like doing, right? You always get, you're lucky if you get sort of 20% of the people that are involved in a project completing the evaluation. So making it part of the funding agreement, I think is a way to go forward to help you out and really capture those key learnings. But also taking a more qualitative approach, right? It's not only about the numbers. And so we ask people, can we have an impact statement from you? And they're more than happy to provide an impact statement about how did our funding or our granting change the way they're doing things. And you can capture a lot of nuanced, rich information from doing something as simple as asking for an impact statement, right? It doesn't have to be a survey every time. And so try to think about different ways of doing evaluation. Sarah Morton also, she's kind of a bigwig when it comes to evaluation in KMB. She has this model, but basically she argues that for outcomes or for outputs like a webinar to become an outcome like raised awareness or something, or increased knowledge, it needs to go through someone, right? So really focusing in on that, right? There's a story there of a person learning something, right? People are at the heart of change-based efforts. So really focus on how do your outputs that you do become outcomes? For whom and why does it happen? And doing that evaluation helps you create a story so that you can tell the story of evaluation, why your project or initiative worked. So anyway, if you're interested more in sort of her work, just reach out to me. I'm more than happy to chat with anybody about that.
Great, thanks so much. So I'm going to move on to our next prompt here. So we're talking a lot about accomplishments, but as well, we know that, as things move forward, we run into challenges and run into barriers as well. So what barriers have you encountered when developing and implementing knowledge mobilization strategies or plans? And how has your team creatively navigated them? And maybe Erin, I'll start with you on this question.
It's an interesting question, Amanda. We, I think, continue to learn at each endeavor and at each interval. So certainly one of the barriers for us in children's mental health was resources that we're not naturally afforded, the resources that we want, and also I think broad thought. So we needed to be really introspective and authentic in our own kind of positionality. Then also what it is that how we were scoping projects and how we were developing timelines and working toward a goal. We also saw lots of challenges and barriers with finding participation. So we've grappled as an agency, certainly wanting to develop engagement for many, many years. And I'm happy to say that we're one of the children's mental health agencies that has a family engagement lead on staff. But we would run into the problem where we felt like we were getting the same voice. So how did we reach not the highly engaged voice, but how did we reach potentially those that maybe hadn't accessed our services, wished that they would, had constructive feedback for us, but weren't highly engaged. So we have youth representation, family representation in committee, but how do we reach other people in our community? And then I think language became a focus. So certainly, as I spoke about in my presentation, we're learning about how our language isn't often accessible, and how we're often also too not accessible from our own positionality. So being able to be clear and declare biases, and then the production of knowledge. So we are very fortunate to have a foundation that supports us in NPR and development, but that is a different skill set. So how we were communicating information, how we were putting it out for consumption. And I think there's always a tension between how we're putting it out and accessible, and how it's going to be reachable, but how we're responsible to being an evidence-based children's mental health agency, policy, practice, standards of care to our funders. So I think those are the challenges that we continue to traverse and be mindful of as we think about different initiatives and knowledge.
Yeah, absolutely. We have an audience question as well that really leads into this topic about challenges. So I'm going to ask it to everybody, but I'm going to start maybe Sarah with you in the context of this question. So thinking about those challenges and maybe as well coming from another intermediary organization. Have you found any barriers to knowledge mobilization that have developed in the wake of the pandemic that were not there before, or have become much more obvious as a result of what we've been dealing with over the past few years? And if so, any ways that you've managed them?
I mean, maybe I'm thinking about how I recognize that people had a lot going on in their lives before the pandemic, but I feel like the pandemic just amplified that in an intense way, right? Like a lot of life has been happening in the past 3 years. Lots of things, I mean, lots of positive things, lots of more complicated things, right? Like people getting sick, people needing to navigate childcare, other things happening. So I feel like one of the key challenges that we've experienced in this time is just that things take longer than you think they're going to. And in terms of how we've kind of met that challenge, we've learned to budget more time than you think you're going to need and have a longer runway for deliverables to launch, just to give people that additional flexibility, just because it feels especially crucial right now, given everything that's going on.
Yeah, absolutely. Abby, is there anything that you'd like to add to what others have spoken about so far in terms of kind of overcoming those challenges?
Yeah, definitely. I mean, I think that something that my team really noticed, especially during COVID, was it seemed like all at once a lot of resources just popped up, and there were so many resources that were so well intended, could support students so well, but because of the abundance of resources, it was almost counteractive in that my team found that students were really getting overwhelmed by the amount of support services that were out there. And with that, Good to Talk was really kind of getting lost in the crowd of all of these resources, because we were primarily promoting ourselves through social media, as so many were during COVID. And so what my team really realized during this time was that we needed to kind of take a step back and really be creative about how we were going to reach students and where we were going to reach students. One way that we did that earlier this year, this was one of my favorite campaigns that we've done. We launched what was called our Tag to Win contest, where students would go to their local pizza shop and find a Good to Talk branded pizza box, take a photo of it, put it on their Instagram story. It's so random and unique that it was it really grabbed the attention of a lot of folks. And they were entered then in a chance to win for an Amazon gift card. So this initiative really allowed Good to Talk to kind of stand out from the crowd of, we're not just promoting in wellness centers and posters on the wall, but there's a Good to Talk pizza box in a pizza shop. And it really just kind of reminded my team, at least specifically, to potentially just start broadening our definition of what reaching students can look like, and outreach and marketing in general. It doesn't have to be those traditional channels of social media promotion, wellness center events, stuff like that. And while those will always have a place and are absolutely important and crucial to also maintain, that it can also be expanded into a really kind of creative initiative. So that's something that I'm excited to kind of continue with our outreach strategy, at least, and trying to share Good to Talk information more widely with students. But yeah, that was definitely initially a challenge, but one that I was happy that we navigated.
That is a wonderful initiative. I feel like anything that involves pizza, like,
Yeah,
sign
I'm
everybody
there.
up, right? If there's pizza
Yeah.
involved, we're there. So we're talking a lot about working with, partners and different sectors and young people and families in this work, right? That's a constant theme that we've talked about today, is that engagement piece, that working together piece. So the next question that we have is, how can organizations really meaningfully engage with different groups? And that includes young people, families, caregivers, but also clients, clinicians, researchers as well. I mean, there's so many people that need to be factored into this work. So maybe Sarah, I'll start with you with this question again. So, at the Knowledge Institute, we work with partners from so many different sectors. So how can organizations really have those conversations with different groups when it comes to knowledge mobilization? And are there any specific considerations that we should be having as well?
So I would say involve stakeholders from the beginning and authentically engage with community as equal stakeholders and co-developers of the project. So what are community members' priorities? And also, I feel like I recognize there's a question coming up about this, but I feel like it's also useful to respond to it here too. Recognizing people's lived experience as knowledge, recognizing traditional knowledge from Indigenous elders and knowledge keepers as like equal knowledge to that knowledge that's coming from clinicians as well too is another crucial piece of this work.
Yeah, you raise a really good point, right? About, also kind of reformatting the systems as well that we engage, right? Like really, kind of moving away sometimes from that colonial approach and taking more of a two-eyed seeing approach, especially working with, Indigenous partners. Erin, anything you'd like to add to that in terms of, how you're engaging with different partners within your organization?
I would first concur with Sarah's point that it's important to be, I think, humble about perhaps your vantage point of knowledge and valuing and seeing the value in multiple sources of knowledge. And it takes work. It takes a work around your positionality. And I think Travis's earlier point, when we're thinking about if our end goal is an outcome, if it's that we're impacting a population, if it's we're improving services, how do we move from an output? It really is that connection to the service user, who we're trying to target, and understanding that we singularly can't develop that. We might be well-intentioned, but to be, I think, very thoughtful in, or at least this is my perspective, to be very thoughtful in what we're hoping to accomplish, what are we hoping to put out, and thinking about that from the inception of the initiative or the idea and how we get there, and then who and how we might integrate, but also being flexible as you're moving through a project to think, well, are we missing a voice here? Or really looking at that feedback, is there something that we're not reaching? And so I think being in a state of assessment, evaluation, flexibility, and growth and openness. So it is challenging because it takes time. And so time, as others have said, is difficult, is challenging. And that's where, if I speak to some of the partnerships we've had with the Knowledge Institute, that's the benefit of being able to leverage your expertise, because we don't necessarily have all of that infrastructure, but we have the same goal. We have the common goal of wanting to improve and create more accessible, better programming, to be creative. But so I think it is being able to be very thoughtful about what we're trying to do, and to be very clear about what limits we need, and I think to be flexible as we're going through.
Yeah, absolutely. Those are some really great points. Travis, in your work, it's so everything revolves around knowledge mobilization, right? Like that is what you do. That is the focus of FRAME. So what considerations would you give to organizations in this type of work who are needing to and wanting to engage with different groups, but also recognize there needs to be a balance with managing those knowledge mobilization needs?
Yeah, I think when it comes to engagement, my recommendation is always as early as often as is appropriate for the project. But a good place to start, I would say, is thinking early about, who needs to be at the table, and more importantly, who's missing, right? Who's not at the table, maybe who's been systematically uninvited to the table that needs to be there meaningfully to be engaged. So, start engagement as early as you can, set up the processes for safe space, and really work to create enabling context where people can share their knowledge in a safe and effective way. That might include capacity building, that might include allyship. There's a number of different ways you can do that, but really listening, right, to those people that you want to engage with. They'll tell you, right? That's probably the easiest part about knowledge mobilization. If you listen, and you listen carefully and actively, they'll tell you what to do. right? Your end users and your knowledge users and your stakeholders will give you the solutions. But it's not just about also inviting people because they have lived experience or lived expertise. People come with multiple forms of expertise, and lived and living expertise is just one of those forms. So youth themselves, isn't a homogenous group. We need to really work to see people as a whole. And so that's part of the reason why we started the matching support service, is that we want to match projects with people with multiple forms of expertise so that they can exercise all their forms and be seen as a whole person, right? Not just a youth with lived expertise, but maybe a youth with lived expertise that also has a passion for communication or art and design and is has a family and they're a whole person. So really taking that sort of intersectionality approach to the work that we do is really important for meaningful engagement.
Yeah, absolutely. Abby, we have a question I think that is appropriate for this topic at hand from the audience, saying that working on the Good to Talk project, the Knowledge Institute, wondering if you could share some examples of how you tailor knowledge mobilization strategies to university staff versus students.
Yeah, absolutely. That's a really great question, and I think it's an important one. It's important to recognize that although staff and students are in that general post-secondary space, the way that we share our information has to be very, very different. They're very different groups of people. I think that the way that our outreach team goes about it, specifically for staff, is it's almost a little bit more formalized, in that we have those one-on-one meetings with staff to really ensure that they're aware of the Good to Talk service, aware of the supports that we offer, the additional resources that we have for students, and really trying to have those touch points at least once a year, if not at the beginning of each semester, just to make sure that any new staff are really aware of these resources, and any updates are kind of shared through those calls. Versus chatting with students, we have to be a little bit more creative. As I said before, there's a lot of information, especially being shared on social media. So to set Good to Talk apart from the crowd, we can't engage in too much long form types of content. I think that's something that we've really recognized, is having shorter videos where students, can just view it for 10 seconds. Versus a 2-minute explanation of everything that Good to Talk offers and all of these access points, but really keeping it a lot shorter and a lot more to the point, is really important, because I think we've seen the attention span of students is decreasing a little bit, and especially after so many students sit in hours and hours of class every day listening to a lecture for a 3-hour period of time. They really just want something that's going to grab their attention, get the information right away, and then they can kind of store that information and continue on. And so, it's quite different. We wouldn't necessarily take that tactic with engaging with staff, but that's kind of how we've been going about it.
Yeah, that's a really good point about that timing of like the attention span, right? And that engagement piece. And, something that we also think about too is like those different forms of learning, right? Like, that tacit knowledge, or those micro learnings, those ways to actually like share that information that are a little bit less burdensome on the person that we're trying to reach. Erin, I have a question from the audience that I think also relates to this engagement piece. So this person asked that they primarily work with clients for whom digital platforms and services are difficult or sometimes completely inaccessible. So as such, many of them have disconnected from services because they can't as they were previously accessing them. So they found that many of them and their caregivers are still very hesitant to re-engage with those services. Has anyone been able to address or specifically engage those that have disengaged over this pandemic period?
Well, it's a great question, and I think it's an experience that I can relate to, because we've certainly had that at Pathstone. So we did offer service through the entire pandemic, but virtual care isn't the preferred, nor is it accessible to all, and certainly lots disengaged. We recognize too, we were very centralized in terms of our services. So one of our initiatives, our newest initiative, is we have put our walk-in site in the local malls. So trying to be where youth are, we've tried to be, again, more forward in our accessibility. So more speaking events at local schools, communities, working with parent groups, having things indicated on our social media, but creating spaces, I think, I don't think we can feel like we can understand, but we want to understand what has disengaged population and how might we re-engage, what feedback could we gain. And I think to Travis's well-made characterization, people are not just one way. So everyone has a different experience and a different voice, and we're trying to be open to collecting it, hearing it, and understanding it, but it certainly is a challenge. The Niagara region, if anyone knows, is vast in its size and its configuration is very different. So we're multi-site, but we don't serve the whole community. So we've certainly tried to be introspective as an agency to think, what can we do, and trying to engage to hear that voice.
Yeah, absolutely. Thank you so much for answering that question. We have so many questions coming from the audience, but I'm also mindful of time, so I think I'm going to move us forward. We've talked quite a bit about today, the engagement piece about different groups and allyship, and how are we actually recognizing people as individuals, and not, creating broad strokes in terms of those engagement pieces and the work that we do. So this question is for all of you, but how do you begin with and use an EDI lens throughout your work? We know that engaging relevant partners in the community and creating knowledge mobilization materials or initiatives that are tailored to that audience increases the chance of uptake and engagement, but also inequities, privileges, power relationships that are found within those more traditional knowledge mobilization, research, evaluation type of institutions can be both obvious and subtle. We might not even realize it coming from the lens that we're in and the work that we do. So could you share an example of when you used an EDI lens in a knowledge mobilization strategy or initiative? And maybe Abby, I'll start with you on this question.
Yeah, absolutely. I think that it's such a great question, and again, is such an important question to chat about. It's crucial that we keep EDI as a priority throughout every layer of work within our organization. And I know that, I'll speak a little bit on Kids Help Phone, and that kind of extends to Good to Talk as well. But within Kids Help Phone, we really ensure that starts with our frontline workers, ensuring that they have taken the necessary training in terms of equity, diversity, and inclusion, so that they are able to support any young person that comes to Kids Help Phone and comes to Good to Talk in need of support, and that they're able to really serve these diverse needs of youth across Canada. But that also needs to extend into our internal teams, even if we are not directly in contact with these communities and these groups that we're trying to reach. We're still providing work that might eventually trickle down into these spaces. And so it's important that we have an equity, diversity, and inclusion lens with everything that we do. Within Kids Help Phone, we have an entire department, it's called IDEA, Inclusion, Diversity, Equity, and Accessibility. And so with every training that we provide, with every support and resource that we're sharing, we really make sure that it meets these standards. I think that, it's also really important to have designated teams and designated folks within your organization that are working with equity deserving communities to understand their perspectives and understand what are we doing that is working, what are we doing that isn't working, and how can we curate our efforts to ensure that we are meeting the diverse needs of these communities is so important. An initiative that we kind of do at Good to Talk specifically with our outreach team is we have annual calls with our contacts at Indigenous institutes. So that's really important because our outreach strategy that works for a typical university doesn't necessarily work for an Indigenous institute, because they're different communities and different groups of people. And so really speaking directly with these communities of how can we curate our efforts and how can we better position ourselves to support Indigenous students, for example, is extremely important. And going in with more of a learning perspective of, you're not going in and saying this is what we do and this is what we do, but more so just asking open-ended questions and going to be open to their suggestions and really take in their feedback so that you can take that back into your team and kind of curate your efforts that way.
Yeah, that's really interesting. I think something that you brought up that is resonant with me is having that capacity, if possible, within the organization, right? Like really having that dedicated focus and making sure that it's its own work, and it filters through every aspect of the organization and everything that you do. Travis, maybe I'll pass this off to you next. You know, thinking about that knowledge equity piece, some considerations that you have in terms of that EDI lens at Frame.
Yeah, absolutely. I would say do the work first, right? The onus shouldn't be on the populations that you're trying to engage with to educate you. So educate yourself. Humility here goes a very long way, but recognize that people don't know what they don't know, right? So taking time for reflection in your work is essential, especially when it comes to EDI work. I would recommend to talk to the organizations that work with the populations that you're interested in. You know, they can help shed light on ways of working and knowledge that you may not have thought about. Aim to work in a good way with reciprocity and open hearts and open minds. And when you're ready, talk to the people and the end users themselves, right? EDI and implementing EDI practices requires a lot of work up front, but doing this work results in knowledge mobilization ultimately that's more relevant, accessible, and importantly, appropriate to the populations that you're interested in working with. So at Frame, we put in a lot of effort up front. We've rewritten entire grant streams, you know, once we've heard about what people need, once we've engaged with people in different organizations. You know, part of what we do is trying to have everybody at the table. So that's why, you know, our grants are adjudicated by and with people with living expertise, especially if there's populations that we're interested in. They're the ones deciding who gets the grants, right? And what comes of them. I'll also say, you know, Frame, I mentioned this in the question and answers a little bit, but Frame really works through a knowledge equity framework, which acknowledges the epistemicide that's happened, which is the undervaluing or the shutting down of knowledge systems, different knowledge systems. And so we really work to bring that to the forefront, to ask who's not at the table. We incorporate allyship throughout our work. So we really value the diversity of lived expertise, ensuring that, you know, all those voices are brought to projects. We work to create safe spaces with the people that we're engaging with. We have a bunch of different tools that we use, and I'm sure they'll be shared in the chat, things like the flower power, but also coming up with sort of rules of decorum and what does a safe space look like, and co-designing that right at the very beginning of projects with the people that you're working with. And capacity building. We do a lot of capacity building work so that we ensure that everybody's can fully participate to the best of their abilities in whatever we're doing. So yeah, it's not easy, right? Embracing and leading into those quote unquote difficult conversations can be for some organizations challenging, but it is worth it to, at the end of the day, to ensure that we are hearing from the youth, from the diverse youth that can really use and appreciate and benefit from the knowledge that we share.
Yeah, absolutely. Aaron, is there anything you'd like to add in that, coming from that, you know, that agency perspective and kind of breaking down those power relationships and working with the community that you're serving in terms of having these conversations?
I absolutely would agree. We felt the responsibility to do internal work first. So really, you know, we've embedded the inclusivity and accessibility as ideals in our strategic plan, but they're just words until you make meaning of them. So it really, we've put in a long-term effort, and it's a continued effort, whether we were talking about being trauma-informed agency or an agency that works from an EDI lens. It's it's incumbent on us to do the work and to take the position that we don't know what we don't know, but we have to be able to be introspective of ourselves as a collective, as an agency, and that it includes power. So we've been doing a lot of work recently about shift in stance, just in terms of how we deliver services, and it extends throughout. And we do leverage partnerships, but to Travis's point, it has to be that reciprocation. It isn't just I'm coming to you to give me this knowledge so that I can do this way. How can we bridge this gap? How can we? So I think being in a state of inquiry, being in a state of introspection, and to create safety in learning. So as an agency, it really has taken a lot of work for it to be safe to learn and inquire and question and declare our different relationships to power, structures, positionality, and I think intersectionality. So all those terms we've talked about, but it's ongoing. It isn't just a crisp answer to me, and I don't think it's a succinct endpoint process. It's really continuous. So we have, I think, invested in resources, time, and space to continue to develop where we stand as an agency, and sometimes how we're contributing to inequitable systems, and where can we change, and sometimes there are things far beyond us. So there's things on the micro level, but then on the macro level that we have to look at a broader system and how we might have a voice in changing that. So for example, I can just say we have a local protocol, and we have taken a position as an agency that we're not signing it until we feel that authentic engagement with family has happened. And so we see it as involvement. And so we've taken a stance, but it's a complicated stance. So it's being prepared to also do that as an agency. And thankfully we have that commitment from our leadership and stakeholders, but they do often, we have different pressures.
Yeah, for sure. Before we move on to the final question, Sarah, I'm going to bring you into this conversation. We have a question from the audience that I think is relevant in this discussion we're having right now. So we're talking a lot about, that knowledge sharing piece today. How do you decide what knowledge is worth sharing or what's considered knowledge, right? This is the conversation that we're having right now, especially when we're talking about EDI. We know that traditional ways of knowing and other ways of knowing are not necessarily seen as quote unquote valid or rigorous enough in this knowledge and evaluation space.
Erin, thank you so much for the language of naming and shifting power. That feels so crucial right now, and it's such a crucial component of doing this work. Like, we in the mental health and addiction sector have a lot of work to do to partner with Indigenous agencies, elders, and knowledge keepers to center the importance of the knowledge that they have. And I think a question that I ask myself often in my work and just in my life more broadly is, like, how do I and how do we signal boost, support, and uplift this knowledge and this work that's happening by Indigenous agencies, elders, and knowledge keepers, like trying to center their expertise and see if there's ways that we can support and follow from behind. I feel like that feels really crucial for me, just personally. I don't know if others want else will speak to this too.
I would agree the following from behind. So, we wouldn't coin ourselves an ally until we're offered that. But we certainly work very closely with our local Indigenous community, but in a place of learning and a place of partnership. And I think that it's and humility was the word that comes to mind when I think about EDI efforts, and specifically with our Indigenous community. We have to be, and have tried to be really clear that, we are coming from this perspective. However, we are open and want to learn and want to be a partner if engaged and if asked, but we're not taking the forward step to request partnership or request allyship or to declare ourselves in that state.
Yeah, those are some great considerations as well. Thinking about, it brings me back to what Travis was mentioning earlier about that so what, right? Like, I mean, what really, like, how is this actually going to be at the benefit and for those that we're asking to engage with, I guess, versus like, what are our goals, right? Like, so really following if we want to be having those meaningful discussions and working with those partners. So I'm looking at the clock and we're definitely running very short on time, but this has been such a fruitful discussion today. So to close off our session, and maybe what I'll do is I'll just ask this question and open up to the group, whoever wants to answer. So what do you see as the future of knowledge mobilization in terms of how information is, developed and shared and used to create change for young people and families? Are there any initiatives that we should be looking out for, or you think that are just kind of on that front burner of taking off?
I can jump in here and then I'll pass it over to Travis. I think that's something that we've seen growing in popularity, and I think will continue to kind of, be an approach for knowledge mobilization, is this idea that we've all kind of chatted about briefly of co-creation, but also specifically a peer-led approach. So I think that I can really speak to the kind of student space of it, but it's really, really amazing to see the passion that students have for knowledge sharing and for resource sharing. And through Good to Talk, we have a student ambassador program, and it's just so amazing to see that students will volunteer their time to providing resources to their peers and kind of extending that into the peer-to-peer community. I think it's become really obvious that peers are a lot more likely to engage in help-seeking behaviors when they're receiving information from a peer that they can relate to, that they can resonate with. And so I think it's really important for organizations and agencies to begin to recognize this and work collaboratively with the communities and the groups that they're trying to engage with, because I think that is really going to be where the impact of knowledge mobilization can lie. So that's kind of my 2 cents on it, but yeah, I'll pass it over to Travis now.
Yeah, absolutely. Co-creation, collaboration is going to be essential. It's essential now, and it will be even more essential to meaningfully engage those and work with them throughout projects. Also add, though, expand your idea of what knowledge mobilization might look like and how you measure success or impact, right? Democratizing knowledge can have a huge impact, even if it's not the type of impact that you're sort of familiar with. Really looking at mental health and addiction more holistically, I think is the future of knowledge mobilization, especially in the sector, expanding beyond sort of the individual or the individual issue. And we're moving that way, which is great. But I'll also say, let's try not to recreate the wheel, in terms of innovative solutions. I mean, you can even do things like looking at the private sector, right? TikTok, Uber, right? They're great sort of mobilizers of knowledge. A lot of people, a lot of different organizations might see those sort of private organizations as bad, and us good. But they have it down to a science, that how they communicate, how they frame their messaging, how they mobilize knowledge. So don't be afraid to look outside the sector and see what's happening and replicate some of that great work.
Yeah, those are some great points. Do others have any final thoughts before we close off our discussion period? All right. Well, I guess we're moving to the last few minutes of our session today, and I just really want to thank you all for such an engaging session. I think we can agree that knowledge mobilization is an ever-growing area for exploration and opens up many avenues to ensure that not only children, young people, and families, but also our other partners across the province have access to that current information, skill development, resources, and how best to work with their communities to make things accessible and available for target audiences. We've seen from today's session that with challenges also come opportunities to reinvent the way we develop and share knowledge, but also what we think even knowledge is that best meets different groups' needs. So a few reminders before you sign off with us today. You will be receiving a brief evaluation when you exit the webinar. We ask that you please take a few moments to complete it and let us know hopefully what we did well, but also where we can learn for future sessions. In the coming days, the recording of today's session will be available on our website. And I know we talked a lot about resources today, so perhaps finding opportunities to share some of those resources from our partners and our panelists. And we'll circulate that in a link in a follow-up email as well. Look out for our knowledge mobilization toolkit that is coming in April. We expect it to be a fabulous resource. Thank you so much for spending your lunch hour with us today, and we really appreciate you taking the time. And thank you again to our panelists. Have a wonderful day, everybody.